I'm Dr. Mudit Khanna, Consultant Orthopedic Joint Replacement Surgeon at the South Mumbai unit of Wockhardt Hospitals. Today, we will be trying to address how someone could figure out or find out whether they are beginning to develop osteoarthritis of the knee. Osteoarthritis of the knee is a condition where you lose the cartilage that surrounds the bone around the knee joint. So, to know whether someone is developing arthritis or not, there are two important symptoms or signs that we get to see. The first, a symptom, and the second, a sign. Now, when we talk about symptom, the most important symptom is pain. So, when osteoarthritis begins to develop, people start noticing pain around the knee joint. Usually, this pain initially is on the inner side of the knee, and majority of the times patients notice this pain after a prolonged period of inactivity. So the first time they notice the pain is maybe they're sitting at the dining table for a long time, half an hour, and when they get up, the first few steps tend to be difficult. They might sometimes limp for the first few steps and then they are completely all right. Sometimes they may find it difficult to get up and down the stairs. So, going up the stairs, they start feeling pain in the knee. Sometimes coming down the stairs, they start feeling pain in the knee. At times, they begin to notice this pain after a prolonged journey in the car. So, getting in and out of the car begins to get painful. So, essentially, when arthritis starts, it is usually pain that is observed after a period of inactivity, and it resolves on its own after the first few steps. As this arthritis progresses, the pain tends to become more persistent, more severe. They get more and more difficulty in trying to walk long distances, and to compensate, they start reducing the distances that they walk. For example, if somebody was walking for 30 minutes a day and was comfortable and then used to develop pain, these patients start reducing the distance or the speed at which they were walking. So they now walk for 20 minutes, and then gradually the distance and the time for which they can mobilize without pain tends to come down. The second important way to know whether someone is developing arthritis in the knee is deformity. Now, there are two kinds of deformities that you see in arthritis patients. One of them is bow legs. Bow legs in medical terminology is known as varus knees. So, if somebody has arthritis developing on the inner side of the knee, which is actually the more common form of arthritis, then these patients wear out the cartilage on the inner side, as a result of which the knee tends to bend in a way that they appear bow-legged. So, if we see somebody in pain and bow-legged, we almost always know, even without an X-ray, that this patient is very likely to have osteoarthritis in the knee. The second deformity that we often see in patients with arthritis, and this is usually more common in patients with rheumatoid arthritis, is knock knees. Now, if a patient has pain and has knock knees, then again extremely likely that this patient has some form of arthritis in the knee. Knock knees develop when the arthritis is more prominent in the outer compartment of the knee. So, if the outer compartment is worn out, then these patients develop knock knees, which we in medical terminology call as valgus knees. So, yes, a combination of pain, which is progressively getting worse, more prominent after a period of inactivity, and an obvious deformity either in the form of bow legs or in the form of knock knees are the two clinical indicators that someone is developing arthritis in their knees. Thank you.